joining the webinar. So welcome everyone to this webinar, The Impacts of Cash in a Pandemic, Evidence from Cash-Based Programming in Low and Middle Income Countries. We have a great team of panelists for today. I'm going to present all 4 of them, and then we're going to have 20-minute presentation for each of them, about 20 minutes, and then we will have a Q&A session for each of the presentations, so you can use the Q&A function on your screen to submit your questions, and the panelists and I, as a moderator, will do my best to help answer those questions. Can you scroll to the next slide? Sorry, Kara. Kara, are you moving the slides? Because we are still in the first one.
I think it might, let me try again. Sorry, everybody, for the technical difficulties. Do you see this now?
Yes, now we can see it. Thank you. So I am Ana Serrano. I'm a Policy and Partnerships Manager at IPA in Colombia. And we have 4 panelists for today. We have Pablo Querubin, Assistant Professor of Politics and Economics from New York University. We have Kibram Tafere, Economist in the Sustainability and Infrastructure team from the Development Research Group at the World Bank. We have Naercio Aquino Meneses Filo, Full Professor and Coordinator at the INSPIR Public Policy Center. And we have Dan Stein, Chief Economist at ID Insight. So welcome to all the panelists. Thank you for joining this webinar today. And we'll get started with Dan's presentation. So to everyone, just remember to submit your questions on the Q&A function, and we'll keep track of the questions there to get them answered at the end of each presentation. And just one more thing before we get started, Pablo and Dan we're going to be presenting first. They will have to leave before the end of the webinar, so they apologize in advance, but you can submit your questions for them during their presentations.
Great. Okay, I'll go ahead and share.
Thank you, Dan. Go ahead.
Okay, can we see? Am I visible and heard? Everything good?
Yes.
Great. Okay, well, thanks so much, everybody, for joining me, joining us. So I'm Dan Stein. I'm the Chief Economist at ID Insight. This is a paper with a bunch of collaborators, both within and outside of ID Insight, that's speaking about a cash transfer program in the Kiryandongo refugee settlement in Uganda. Okay, so we're going to do a bit about the context, but just this is kind of a preview on the whole thing. We learned that life is difficult in the refugee settlement. That's not going to be a shocker, and that the shocks of the pandemic harmed people. Specifically, food security is poor, but the cash transfers improve food security, which is great. We also looked at intra-household conflict, and we find that intra-household conflict is moderate to begin with, and cash does not appear to do too much. We find limited effects on COVID-19 practices. We sort of hope that maybe with more cash, people could have do more social distancing. Didn't really see that. We saw a high effect on psychological well-being, and we saw better effects from earlier treatment. So that's the preview, but let's get into what we're actually talking about here. So a little bit on the context. So we're in Uganda. We're in the Kiryandongo district, which is the northeast or northwest of Kiryandongo. And then very specifically, we're in the Kiryandongo refugee settlement. And I think a couple of things to know is that the settlement is like pretty close to the main road. It's near a larger town called Boyale. It's near a bunch of farmland. It's a lot of times when people think of refugee settlements, they think of somewhere like off in the worst possible land, away from people. But this is really relatively integrated on decent land. close to roads. So definitely the hope was that cash transfers would allow refugees some longer term income generating possibilities. That was part of the logic of the program. And just a little bit is that most of the refugees are from South Sudan, and most arrived in 2014 during the South Sudanese Civil War. And a lot of people are sending money back to South Sudan. So South Sudan's GDP is 35% remittances. So what do our households look like at baseline? I'm going to show you a timeline in a second, but we did a baseline in September through November of 2019. It's an interesting example. Most of the households are female-headed, which is a little bit has to do with the context. A lot of men either stayed back in South Sudan or unfortunately didn't make it after the Civil War. Average head of households 35 years old, 9 members. Almost everyone have kids, and about a quarter of the households are involved in polygamous marriage, multiple wives for one husband. Not a lot of people are working, so less than 10% of the time in the previous day's unemployment, and roughly 30% had a business and 20% had a non-ag business, and usually that's petty trading. Okay, so let's talk about, I'm going to use this timeline graph to talk about both the timeline and the intervention and a bit about the evaluation design. So get ready to hang out with this graphic for a little while. So where are we? Well, here's a big thing that's happening is that this context, which is right at a key part of our study that we'll show in a second, in April 2020, which also, as you remember, is when the pandemic is starting, and we're going to get that in a second, there was a pre-planned reduction in rations in for the refugees, reducing total rations by about 30%, and changing the timing of these rations from monthly to every other month. So there's this planned shock that comes from World Food Program being budget constrained in April 2020. And then that happens to happen at the same time as COVID. So also in April 2020 is the beginning of the curfew and lockdown. And Uganda has one of the strongest lockdowns in the world for a while. Everything shut down. If you remember, schools are closed. Oh boy, schools were closed for quite a while in most of Uganda. They actually did reopen in the refugee settlements a little bit earlier, but there's basically this harsh lockdown right at the same time as the cash ration, as the World Food Program food rations decrease. And so what does the time look like for Give Directly? So as you may or may not know, Give Directly is a nonprofit that's giving one-time cash transfers to its recipients. In this case, it actually gives the transfers in three buckets, but they're all within 1 to 2 months. So you can think within 2 months, these households are getting around $1,000 in a one-time transfer. And they're intending to treat the whole refugee settlement. But what they did is broke them down into 24 cohorts, because Give Directly has to go into the field, it has to verify households, it has to sign them up, it has to actually transfer the cash. So it's planned to do it to the entire refugee settlement of 10,000 households over 2 years. And what we did a public lottery to allocate households to each of these 24 cohorts that determined the timing of the transfer. So that happened in August 2019. And the question, why did we do a lottery? Well, like I said, there was this staff time for enrollment. It couldn't enroll everyone at once. We also thought it was maybe not the best idea to drop all the cash at once on the settlement due to inflation risk. They're relatively well connected to markets, but not completely integrated. There was also a bit of a funding issue. Give Directly, when they started the program, they didn't actually have funding for everyone. They had a good idea where the funding was going to come from, but they didn't actually have the money to give it to everyone at once. So they decided to do a public lottery, which solves these logistical issues, and it also helps us run an RCT. And a little bit on the details, So everyone in the household got it. It excludes households with special needs, what we call these PSN households. And what we did is we took the first two cohorts and said, this is our treatment group. And then cohorts 17 through 20, we leave as our control group. And these are randomly allocated by this public lottery. You can see what happened. People picked numbered ping pong balls out of a bucket in order to assign themselves. And just a little bit, 85% of the response, we asked people what they thought about this lottery thing, if they thought it was ethical, if they thought it was fair. And the answer was overwhelmingly yes. 85, almost everyone said they thought it was fair, and 85% said they thought it was the fairest approach possible, which is good to see. Okay, so then what happens? There's a lottery, and then starting in February 2020, they start distributing cash transfers for cohorts 1 and 2, starting with cohorts 1, and then moving on to cohort 2. And so this is really the key part of the timing that we couldn't have possibly planned if we tried. But these cash transfers are going out right in the month before the pandemic hits and everything shuts down. So if you wanted to do like some sort of experiment on anticipatory cash transfers in front of a shock, this is basically it, even though we had no idea. So then the shock hits and the transfers are still going out, right as the lockdown are happening. So this is really like contemporaneous cash transfers right as the pandemic is coming and everybody's scared. So I think it gives us a really cool, like almost accidental situation to really look at well-timed, better than you could possibly do it in real life, well-timed cash transfers in anticipation of a big shock. Anyway, I mentioned they got around 1,000 USD transferred to their mobile money, and that's about 10% greater than their yearly total allocation of rations from the World Food Program. So it's quite big. And then GiveDirectly kept distributing cash transfers to cohorts 3 through 6, with words in our RCT. And then unfortunately, GiveDirectly's operations were paused in Uganda in September 2020 due to some issues that I won't get into, complicated politics, etc. And they didn't reopen until December of 2021. Okay, so what we did is the data we're going to take from this is we did a baseline in September 2019, standard RCT baseline with cohorts 1 through 2 and 17 through 20, a treatment control cohorts. What's also interesting about the data collection for this is we had a longitudinal qualitative panel, which means at least at first we selected 40 households and did we plan to do in-depth detailed interviews with them every 2 months about their experience with the cash transfer, what they were using it for, what its potential impacts were, questions about gender relations, questions about conflict, etc. I think it's a way to get really detailed contextual data that really complements the RCT. And as we get to the results, we're gonna show data from both our quantitative results and our qualitative results. Anyway, the data that I'm going to present today comes from 3 rounds of phone surveys that we conducted from July through October 2020. This wasn't originally planned in our study. It was additional funding we got after the COVID shock to try and see what are some of these short-term outcomes of cash on coping during the pandemic. So 3 survey rounds that each covered slightly different topics. We were able to reach in each round about 50% of our sample, which is a downside of any phone survey is you get some attrition. I'm not going to show it to you today, but in our paper we try and dig down into whether we think the attrition is a big problem, and we think it probably isn't. Attrition is not correlated with treatment. It's not correlated with other variables that we think, like baseline variables that we think might be correlated to our endline variables. And our final post-attrition sample is quite well balanced on all baseline characteristics. So even though we get a smaller sample, we think it probably doesn't bias our results. And one thing to know is, so then, shortly after Give Directly's operations paused, we were also asked to pause our operations. So our qualitative panel had to pause, and our end line was far delayed, but finally all permissions are back in place, and Give Directly is operating in Uganda again, and so are we. So our end line, which is in-person end line following up 2 years after the cash transfer and one more round of qualitative data, are currently in the field. So next time you see me present this, there's going to be a whole new swath of longer term data. So stay tuned for that. Okay, let's get into some results, which are from this midline in July through October 2020. So again, I'm going to be weaving in qualitative learnings and quantitative learnings here, and I'm going to focus on two outcome categories, which are food insecurity and conflict. And I'll touch on some other ones, but we don't really have time to get into all the different outcomes in such a short talk. So anyway, let's talk a little bit about food insecurity. So what does it look like at the beginning? Well, around 23% of monthly consumption is coming from these World Food Program rations, and 50% of total consumption expenditure goes to food. So already you can kind of detect that that there's some potential food insecurity here. Like we mentioned, the World Food Program trimmed rations in April 2020. Our qualitative data from July 2020 shows that almost everyone this July 2020 data comes from our phone survey, where 97% report facing higher food prices since lockdown. And then in our qualitative interviews, people are telling us very consistently that these food cuts are stressing them out, causing major worries in their household, causing hunger, and that layered on top of the pandemic, where it's harder to get day labor, harder to get any work, is just causing major difficulties for our households. So the households are food insecure. We have a questionnaire that Give Directly has used in a lot of its surveys, including many of the RCTs that I'm going to go through in a second. But basically, we find out that our treatment households have a reduction of about 0.2 standard deviations on our food insecurity index, and I'm going to dig down into it. But we find that pretty consistently in round 1 and in round 3. We ask about food security in both questions, in both survey rounds, and find this decrease. But it is interesting, in our second round phone survey, we did a consumption module where we asked about the total food consumption value, and we didn't find any treatment effects there. That's a little bit head scratching. We talk a bit more about it in the paper, but we don't have a really good answer about that. Anyway, these indices are a little bit hard to wrap your head around. So let's talk a little bit about what effects we're actually seeing. I'm going to present a few of these graphs that show our control versus our treatment group in our round 1 survey and our round 3 survey for a few outcomes. But I think what's important to know is that in this graph, higher lines are worse. This is like more food insecure. So we have a few outcomes. Basically, we asked, in the past 7 days, have you eaten less preferred food? Which we find some modest results on, especially in round 3. Have you gone to bed hungry? Consistently, our treatment group is going to bed hungry less, about 8 or 9 percentage points less of the time. Have you skipped or cut current meals? Again, there's a lot of people doing this, but a little bit lower in our treatment group by about 6 percentage points. And have you gone the whole day without food? Worryingly, 46% of households answering yes to this question in the last 7 days. But we do have a modest reduction of about 6 percentage points in our treatment group, which is it's not really where we'd love to be. We'd love to get these numbers down to 0, but I think it is a notable improvement. There was a lot of worry in this particular context. There's a lot of worry about conflict because people come from both sides of the South Sudanese civil war and move to the settlement altogether and are expected to live in peace and harmony. There's problems with conflict between tribes, and there's also intra-household conflicts. So what did we hear? We didn't really see any clear effects of conflict. Basically, respondents have mixed opinions about whether conflict has increased during the lockdown. That comes from our qualitative work. Some people say it's caused people to drink more. Some people say no. Major causes of conflict are over money, over co-wives, or husbands, which are absent or back in South Sudan and not sending money or whatever. But we really don't hear, we were, especially in our qualitative work, we were looking out for anecdotes and stories about conflict being driven by cash transfers. This was one of the worries about unintended negative effects of a big cash transfer. Would it cause theft? Would it cause jealousy? And we didn't really find that. Really, just one anecdote where someone said receiving cash had led to bitter words, but we really didn't see any types of trends here that would make us worried. So, but that being said, on our quantitative work, we also didn't see obvious positive effects. Because due to time, I think I'm going to skip going through this question. But basically, we asked whether there'd been more quarreling within your house, whether there'd been any incidences of intimidation, whether there'd been any damaging of objects or other people. And we actually see, for this quarreling and intimidation, we see directionally positive effects for treatment, but they're not statistically significant, and we don't see anything on this damaging outcome. So like maybe there's a little something for cash here, but doesn't seem like a slam dunk. Now, here's another thing that's kind of interesting, and I'm sorry, now we get to more recent results where I haven't created yet fancy graphs. So if any of you guys want to squint and see this regression table, but another question might be, does the timing of the treatment make sense? And I said that we have this really cool study timing here where the treatment comes right before the shock hits. But actually, we have these two cohorts, one which they have sort of overlapping distribution of the timing of when they actually receive the transfer. But on average, cohort 1 is receiving this transfer 4 to 6 weeks before cohort 2. So cohort 1 is mostly getting it like really right at the beginning of the lockdown, or sometimes before the lockdown, and cohort 2 is getting it after the lockdown. And if you look at some of these results, specifically this food security index that we showed you before, these high effects are being driven really primarily by our first cohorts, the people who got it early. So in the second cohort, the effects are still positive, but they're lower, and they're significantly lower. So what this is telling us is that there seems to be this much bigger effects on people who got the transfer just a month before the other ones. So that's a little surprising, it wasn't that big of a timing difference. And but these are randomly allocated. We think this is well identified. We think there's something here, and our best guess is that people who received the transfers earlier just had better opportunities to actually make some sort of investment before the lockdown hit. And as soon as the lockdown hits, people became more conservative. There were fewer opportunities. Maybe there was more spending for basic needs. And so there seems to be these like enduring effects for people who got the transfers before the shock happened. And we see that for a couple of our outcomes. This other one, which I didn't show you before, the psychological well-being index, that one's much higher for people who got the cash transfers earlier. A little bit surprising, but it seems to be a robust effect. Okay, I didn't really want to show too many big regression tables, but I just wanted to mention a couple other things at the end that I hadn't quite got a chance to dig into, which is we also look at these COVID practices. Will cash help people access soap and water, wear masks, social distance, etc. And this is up here in panel A. And we didn't really see a lot here. Okay, we thought that people will buy water, they'll social distance. we didn't see much. We saw a slight increase in mask wearing of about 4 percentage points of people who say they mostly or always wear masks when interacting with other people. And this is because although there was some free mask distribution in the settlement eventually, there weren't really enough, and a lot of people said that they bought their masks. So it looks like cash allowed people to buy masks, and that had a small effect. But in our pre-specified index of COVID practices, we didn't actually see significant results. So we can take that one result with a little bit of a grain of salt, given that there's a lot of outcomes here. And the other thing that I mentioned a little bit before in the timing thing is the psychological well-being. We asked about like depression. We used a module to measure depression. We looked at life satisfaction, general happiness. We saw really positive and significant results across the board for our overall psychological well-being index, as well as some of these sub-indices. So if there's any obvious takeaway from this, it's that cash transfers really made people happier, less worried, less stressed out, which is great. Finally, the final result we see that's kind of interesting is that cash transfers allowed people, basically there's free government healthcare, but everybody prefers to go to private clinics, and the households who receive the cash transfers were more likely to go to these higher quality private health clinics during the early days of the pandemic. Okay, I finished 1 minute early, so I'll stop now. Oh, right on time. Okay.
Great, thank you, Dan. Very on time. So we have a couple of questions from the audience. So there is a question particularly about how did you control for attrition? So I guess you can get started with that one.
Yeah, so we didn't really control for attrition because, but I guess it depends what you mean. Like we could have, so basically what we did is attrition was clearly high. I mean, we had something like in our 3 rounds combined, we had something like 70% of people responded at least once, but in each individual round, it was 50 to 60% response, which could be worrisome. And so, like I mentioned before, we did a bunch of tests to try and see if we thought that this attrition was going to cause bias. So we looked to see, is attrition correlated with treatment? The answer is no. We looked to see whether attrition is correlated with any of our baseline indicators that we thought would be correlated with our key outcomes. The answer was no. And we looked to see whether our final post-attrited sample was balanced on key baseline indicators, and the answer was yes. So that led us to believe that there's pretty low chance that attrition is causing any biases. Now, we didn't do some other stuff that we potentially could have done to really try and knock down attrition, really try and account for attrition. For instance, we could have tried to do inverse probability weights based on attrition, but because the attrition wasn't really correlated with because it wasn't really correlated with the things that we cared about, we didn't really think that there was going to be much there. We did do some weighting of actually, I think we actually do present some weighted estimates in the paper of that do some very simple inverse probability weighting that basically change nothing. We didn't go ahead and do lead bounds or anything, which you could do. Just really seemed like this was something that that was not too much to worry about. Maybe a reviewer will ask us to do that.
Great, thank you. So we have another question about financial inclusion impacts. Did you look at any impacts on financial inclusion and I mean, people after receiving the transfer via these mobile money app, they were entering the financial system for the first time, or what did you see there?
So no, we didn't do that in these phone surveys. These are kind of limited phone surveys with limited outcomes, but we have this long qualitative panel that we've been doing that we've actually asked a lot of different components, and I'm trying to think if we have looked specifically on if we've seen anything come up in the financial inclusion outcomes, and I can't really think about it. I mean, definitely because these transfers are being sent with mobile money, you have a lot of people getting phones and signing up for mobile money as a cause of the transfer. And that's very clear. Even if we didn't ask, we know that's happening. In terms of other types of financial inclusion, we didn't really ask, and I don't think it's something that's coming up in our qualitative study. In the in-person end line, we are going to ask about loans and transfers and remittances, which should get a little bit to this a little bit better. We have heard a little bit in our qualitative work, we have heard a lot that people have just gotten the phones, done mobile money once, and then have stopped using their mobile money account. So even though we don't have great data, it's certainly it's definitely my strong prior that there's not a lot happening on financial inclusion outcomes.
Thank you, Dan. We have another question about outcomes on children. Did you look at any specific outcomes on children in the settlement?
Yeah, so the answer is no, not on these phone surveys, which again had a really limited suite of outcomes, but we are looking at that for our end line, where we are doing a household module and asking a few questions about each of the children. We're not asking about food consumption specifically on the children, if I recall, but we are asking about education and school fees, because that was one of the ideas. You know, one of the major mechanisms of cash that we thought might happen was being able to keep people in school. So we'll have some child-based outcomes when our main results come out in a couple months. We've got to get our response rate up in the field.
Great, looking forward to seeing those results then. We have another question about food consumption, and specifically about the food consumption score. Was there a sense of whether the food consumption score improvements for the treatment group was driven by changes in frequency or diversity, or both?
Yeah, okay, so a couple of things. So technically, we did look at the food consumption score. This is like a standard indicator used by, I believe, the World Food Program and others. And we put that was on our baseline survey, and we actually found, somewhat surprisingly, almost no variation in the food security score. Almost everybody was at the top echelon of food security score, despite, you know, like pretty strong amounts of complaints of food insecurity. So we were just a little bit confused and maybe felt like that module wasn't working so well in this context. So in our phone surveys, we switched to this other type of food insecurity module that GiveDirectly has used in a bunch of their other studies. That it isn't one of these like more widely used by the international agencies modules, but we thought it was good because it gives comparability with other studies GiveDirectly has done, specifically their initial big RCTs in Kenya. So that's that. But then to answer your question about whether it was the frequency or the diversity, I flashed it a little bit earlier, but it looks to be both, where lowered frequency, basically more hunger, more skipping meals, people switching to less preferred foods, that's not specifically diversity, but that's generally a proxy for diversity. When people say they switch to less preferred foods, it usually means they're switching away from meat or whatever to staples. So I think that captures diversity a little bit. And we do see impacts on both of those elements. So I think it's a little bit of both.
Thank you. So you've been talking about different kinds of outcomes. One usual question is, how long are you thinking, or like the research team, you're thinking you can do survey rounds to understand like the longer effects and how long they last?
Yeah.
Any thoughts on that?
Yeah, so in terms of the RCT, so I mentioned before we have this phase-in model with different cohorts, and everyone in the settlement is going to get treated eventually. And so now that operations have started up, it's happening at the end of this year. So we have our round, we have our follow-up round in place. That's roughly 2 years after the initial transfers. And shortly after that round is completed, our control households are going to be enrolled in the program, and then the rest of the settlement is going to be. So in terms of the RCT, this end line that's in the field right now after 2 years is our last shot. That being said, there is some interest in the donors we're working with and Give Directly in looking at some longer term outcomes, even if it's just more qualitative or more cross-sectional. So I think actually there's a good chance that there will be another survey 5 years later, which would be, well, I can't remember if we're talking about the 5-year mark or 5 years after this one, which would be the 7-year mark, to try and really look at some long-term outcomes. It won't really be the same because we won't have a control group, and we're going to have to look at things over time, and we're going to have to, we'll have a quantitative survey, and we'll have some qualitative results, and we'll try and triangulate. But yeah, we're hoping to be able to get these long-term outcomes, but no control group in the long term, unfortunately. Well, fortunately for the refugees, unfortunately only for us researchers, which is less
For the
important.
research, yeah, correct. So I guess I have the last question for you, Dan, which is usually there are several actors in the settlement. So how did you handle issues related to contaminations, spillovers, and anything related to that?
Sure. Well, I think that you're right. There's a lot of things happening in the settlement. There's the World Food Program, the big beast there, providing services to everyone. There's UNHCR who are providing services, and there are so many nonprofits, NGOs working in the settlement. Like when you walk through the settlement, there's everybody's posters up for like education or health or whatever. But I do think that our lottery approach really kind of gets around a lot of these issues from a research perspective, because we randomly allocated all of our households into these different cohorts, and that randomization is just totally independent, is completely independent of other things that are going on. So we definitely think while all this other stuff is happening, we think it should be happening equally in our treatment and control groups, and that our randomization is the only difference between the treatment and control.
Great. Thank you so much, Dan, for answering all of the questions and for sharing the research. I know everyone's looking forward to seeing more results. And just so everyone knows, the webinar is being recorded. So you can also see this presentation after if you need to. I just received another question. This is the last one. Do you
want me to do it live, or I can just type it if you want to move on?
Go ahead.
Oh, okay. So I was on ID Insight's website and on Give Directly's website. I can write the link, but there are mini reports from each of these phone surveys, and then also we have the academic paper coming out. It's in final review. It should be out in a month or two. But those mini reports have a bunch of info. I don't know if there was a second part of that question, but it just disappeared. So, so I'm not sure.
No, it says also, do you observe the transaction using e-money and non-cash user? Were there increased during the pandemic, and how many countries do you observe, or how many samples you use for this research?
Well, this is just in Uganda. It's a final evaluation sample of about 1,300 households, but we don't observe mobile money transactions, unfortunately. Though we'll ask a little bit about that in our in-person end-line.
Great. Thank you so much, Dan, for your presentation and for answering the questions. Now we're going to give the floor to Pablo Querubin. So Pablo, you can stop sharing your screen, Dan, so Pablo can share his slides.
Stop share. Okay.
Thank you. Welcome, Pablo.
Right. Let me share my screen. Give me 1 second. Can you see my slides right now?
Yes, but they're not, yeah.
Are they in full screen now? Can you see it?
It's loading.
Oh, it's not working. Wait. Sorry about that. Give me a second. Now it's gonna work. Now it's okay?
Yes,
Okay.
perfect. Thank you, Pablo.
Great. Well, thanks for the invitation. It's a pleasure to be presenting the results of this evaluation. So this is an evaluation of an emergency cash assistance program that was introduced by the Colombian government during the pandemic. You know, I conducted this evaluation together with my co-author Juliana Londoño, who is an assistant professor at UCLA right now and who unfortunately couldn't connect. And we worked with the cooperation as well of the Colombian government, the National Planning Department in particular, and IPA, who were excellent partners on the ground and allowed us to launch this really, really quickly, as you'll see in a minute. So just as a context, which I guess it's helpful for many of the presentations today. So cash assistance in particular has been a key pillar of how governments have responded to the COVID-19 pandemic around the world. So since March 2020, over 156 countries have introduced cash assistance programs, so over 340 cash assistance programs. And this cash assistance represents roughly 50% of all types of interventions during the COVID-19 pandemic. And there's a lot of the research that has emerged over the past years suggests that cash assistance is very important and has the potential to help recipients navigate the economic fallout that followed the COVID-19 pandemic and many other interventions to address the pandemic, such as business closures and lockdowns. So what we're going to do today is present you the evaluation of this compensación del IVA, which translates roughly to like a VAT compensation program, which was a new program that the Colombian government launched during the pandemic. And it's just one out of many ways through which the Colombian government responded through the to the pandemic. So what we sought to do was identify the short-term impact of this VAT compensation on several types of outcomes for the recipients: their financial health, food access and security, political attitudes, and other outcomes that I'll describe in a minute. So let me quickly describe the program. So, even though it's called a VAT compensation, and in fact, initially it had a not very accurate name of like devolución de IVA, which gave the impression that it was like a sales tax or VAT tax refund. In the end, it is simply unconditional cash transfer. Now, the reason why it's called VAT transfer is that the original motivation for this transfer prior to the pandemic was to compensate very poor households for an estimate of what they usually pay on VAT taxes on basic consumption goods. And the reason why the government wanted to do this was because they wanted to launch a very ambitious tax reform that would expand, the VAT coverage to very basic consumption goods. So obviously, a lot of people were concerned that increasing the VAT tax on basic consumption goods would affect very poor households. So the government launched this unconditional cash transfer with the idea like, well, if we increase taxes on these basic consumption goods, we can get, wealthier households to pay higher taxes on these goods, and the VAT compensation will be a way to to mitigate the effect on the very poor. The idea was to launch this program, this VAT compensation program, much later in the year 2020, but it was launched, earlier once the COVID-19 pandemic started, as a way to provide another source of relief. Okay, so as I was saying earlier, in practice, this is just another unconditional cash transfer. The sponsoring institution was the Department of Social Prosperity in Colombia, which is usually in charge of most social assistance programs. This program in particular targets 1 million households in poverty and extreme poverty. And this is very important. These are households who are already recipients of existing social programs, such as Familias en Acción, which is the conditional cash transfer program, or Colombia Mayor, which is a cash transfer program for senior citizens in Colombia. Now, a very important element of this program is it has a very modest payment. So it was represented 75,000 pesos, Colombian pesos, per household every 5 to 8 weeks. So you could think about this like, this is $19 US, or at, with the purchasing power parity, roughly $56 per household every 5 to 6 weeks, which amounts roughly to 18 cents of a dollar per adult per day. So this is very important to keep it in mind when trying to interpret the findings. So it's a modest, unconditional cash transfer household. And the delivery mode, and this is something I'll come back to in the end, consisted of either of hard cash to some household, meaning cash transfers that the households could collect at different payment agencies, or digital payments to a digital wallet used by the bank that was in charge of distributing the payments. Okay, so you could get some digital payment through an app on your phone. So a research question, is very standard, as in any program evaluation. What are the impacts of this emergency cash assistance on financial, physical, and mental health, on political attitudes, and most importantly, also at the time, on other household behaviors to mitigate the spread of COVID-19 during the pandemic? The evaluation method was a randomized design, an RCT. And at the time, in fact, this was one of the first RCTs in the world evaluating the effect of cash transfers during the COVID-19 pandemic. So, we were able to launch this like 2 months after the beginning of the pandemic, thanks again to partly due to the cooperation of the government, the National Planning Department, and IPA, who helped us put together a team of enumerators very quickly. So the sample consists of roughly 3,500 eligible households across 53 municipalities. And again, even prior to the pandemic, the National Planning Department was planning to conduct a randomized evaluation of the program. So they had already randomized eligible households, half of them into a treatment arm that were going to receive the transfer, and another 50%, were randomly allocated to a control group. So these were eligible households, but who did not receive the transfer. So we're going to be able to do this randomized evaluation. We conducted computer-assisted telephone interviews in June. So shortly after the households received the second payment of the transfer that happened in May. And also later on in October, we conducted 35 qualitative interviews to kind of understand some of the empirical findings that we found. Here, this figure illustrates a little bit of the timeline. So the first case of, so I'm here, on the upper left corner, the first case of COVID-19 in Colombia was on March 16th. immediately, the Colombian government closed schools, and in March 24th, the government declared a national quarantine that was pretty long. It lasted until August 31st, and it was a very strict quarantine. Very quickly as well, on March 25th, the government announced that it would disburse an additional emergency transfer of the existing social protection program, so the conditional cash transfer program, Familias en Acción, and the cash transfer programs that were already in place for the youth and for the elder. And on March 31st, they announced that they were going to launch much earlier than planned this new compensación de IVA, which is the unconditional cash transfer program that we're evaluating today. So there was a first disbursement in the month of April, and then a second disbursement during the month of May. And we tried to conduct our survey immediately after this second disbursement was made, so between June 3rd and 16th. So all of our questions in the survey are going to have as reference period either the week before or the month of May, and we're going to try to see what was the effect of this second disbursement on the welfare of many of these households. The interviews, the qualitative interviews in the month of October happened after some additional disbursements had taken place. And on April 4th, the government launched yet another social program to mitigate the impact of the COVID-19 pandemic on poor households. This is a program called Ingreso Solidario. And this one was targeting households, very poor households that were not eligible for any of the other social protection programs. But, needless to say, we're only going to be able to evaluate the impact of receiving this small unconditional cash transfer program and not the aggregate impact of all of the different social protection measures launched by the Colombian government. Going quickly through the data and methodology, as I said, so in addition to the phone survey, I'll describe in a minute, we also used other administrative data from the Colombian government, in particular data on the CISBEN data sets, which are the basically government data sets that are used to target and identify very poor households. So certain household characteristics that we couldn't or didn't collect through the phone survey, we got them through these administrative data sets. We also had more details about the disbursement of the VAT compensation program. So for example, the exact date in which the household received the payment, or the method by which it received the payment, whether it was through a cash transfer sent to a payment agent, or whether they received it through a digital transfer, and other characteristics. So the phone survey, as I described before, was conducted by IPA between June 3rd and 16th to household heads. We were only able to ultimately reach 60% of those 3,500 households that were part of the originally part of the evaluation sample. The participation rate is balanced between treatment and control. So certainly in terms of the internal validity of the study, we're not very concerned about that, but attrition was relatively high. We could only reach we could not reach 40% of those households we intended to reach. Given that all of these beneficiaries tend to be already also beneficiaries of the conditional cash transfers program, a high proportion of our respondents are female and unmarried. So usually unmarried, female heads of households. And the median survey time was, roughly half an hour. We did some qualitative interviews implemented by IPA in October. And as you'll see at the end of my presentation, we wanted to understand a little bit in greater detail what were the implications of receiving many of the payments through this digital technology. So we try to stratify the sample of respondents in the qualitative interviews, depending on whether they received both of their payments through the digital wallet, or where they received some of the payments in cash and some through the digital wallet, where they reported problems with the digital wallet or not, to understand this in greater detail. Okay, before I move into the actual findings, let me just illustrate just very descriptively what some of our participants and also just the extent of the economic impact of the pandemic on poor households in Colombia. So first of all, 43% of our respondents are report themselves to be victims of Colombians' armed conflict. 70% reported to had a paying job in February, and of these, only 43% worked for pay in June. So this is like really devastating in terms of just the simply the fraction of households in our sample that were not receiving any income in June was pretty high. Perhaps this is explained by the fact that 87% of those pre-pandemic workers were informal workers, and thus suffered the most with the quarantine and with the pandemic. 22% of those worked in agriculture, 25% in domestic services, and 12% worked in hotels and restaurants. As other surveys have found, the majority of households, so 53%, report that the biggest concern for them during the pandemic were economic needs, much more than concerns about their health. So the biggest concern of households interviewed was their economic condition more than their health. Only 35% reported having regular internet access in the month of May. And the biggest concern mentioned by households regarding their children's education was lack of access to a reliable internet connection. And this is not surprising given that a lot of school instruction switched to being online. So if you didn't have a reliable internet connection, that made it very challenging to provide any education to your kids. Again, just to illustrate the impact of the pandemic, 58% of households reported having to limit their food portions one or more times during the reference month of May. Okay, so let me now move to the findings. So, since our empirical design is very straightforward, given that this was an RCT, I'm not going to show you any regression tables, since they're simply gonna consist of comparing the roughly the outcomes between the treated and control respondents. So let me start with financial security. So we find some desirable positive effects of the program on financial health. So beneficiaries were 15.5% less likely to report having to sell any assets during the national quarantine. And we find similar impacts for other financial outcomes. They were less likely to have to pawn any outcomes as well. We create this also index, this financial health index that combines all of the different specific questions on finance. And we find, that the transfer had a positive effect on this, index on financial health. Regarding food access and food security, when we ask households how did they use the funds of how did they spend the transfer, 90% of them tell us that they used it to purchase food. And we do find that food access improved by 6.1%. But interestingly enough, we do not find any detectable impacts on measures of food security. So the likelihood that households reported experiencing hunger or having to ration food or number of days in the month in which they couldn't eat 3 meals in a day, it didn't have an impact on that. So one possibility is there's as many previous studies have found, is there's an impact on the kind of food that households purchase with the transfer. So they, purchasing more protein or high quality, sources of food. But since, we're conducting a relatively short phone survey, we didn't ask about specific items that households purchased. So we cannot really explore this hypothesis as an explanation why we didn't find any effect on food security, but we did find an effect on food access. And as I said, most households seem to have spent the transfer on food. Beneficiaries were more likely to invest in their children's education. And this effect was particularly large in urban areas and appears to have operated through the effect of the transfer in enabling access to a better internet connection, which was easier in urban areas. So that was one, like the positive effect on education appears to have operated through access to an internet connection. And finally, we had several public opinion surveys regarding like attitudes on the government. So treated households, so beneficiaries of the program, were 7.4% more supportive of the government's response to the pandemic, but it did not influence more, if you want, longer term outcomes such as trust in the government or trust in the state, nor did it matter in terms of support for other lockdown policies. So, we wanted to see whether one implication, of some of these, economic relief policies is that they generate more support for other policies to mitigate the spread of the virus. We didn't find any effect on them, but I should say that the baseline support was remarkably high. So like 90% of households reported, roughly 90% reported being supporting the lockdown, at least at this very early stage. And finally, something interesting that we found is like there was a very deep sense of community among study participants. So treated households were 3.5% more likely to say that they would be willing to contribute to their community with work, even if not with money, to support others in the community. And this is something we were able to expand a little bit on during the qualitative interviews, since as you'll see, a lot of, in particular, older beneficiaries had to rely on many other younger members of the community for help regarding how to operate the digital wallet. Okay, so these are the basic findings of the evaluation. Let me now move to some, broader discussion about the, digitization of cash assistance, which was very important in our context. So Colombia actually achieved a record time expansion of mobile money during the pandemic. So the use of this digital wallet, digital platform called DaviPlata, almost doubled between the first and the second transfer. So the payment in the fraction of households that received the payment in the payment in May through this electronic transfer, roughly doubled relative to those that received it electronically in April. And today it is roughly 75%. So this is a quite remarkable expansion of this digital technology. As you can imagine, mobile money is disproportionately used in urban and wealthier municipalities that have better cell phone connectivity. But one thing that we noticed is that despite the many potential benefits of these digital technologies, particularly in terms of logistics for the government in very quickly disbursing payments to many households, immediately or in a very short time, there were lots of costs as well. So delays or difficulties were twice as likely to be reported for households that received the transfer, being these digital transfers, relative to those that received it in hard cash. And people reported lots of problems with the mobile money application or their phone or all the other technology adoption issues. And second, and perhaps another important implication is like most beneficiaries that received the transfer through digital transfers went immediately to cash out the transfer as fast as they could. So, you know, the households that received mobile transfers could still go to a bank or to an ATM or to other, you know, cash agents to, you know, just convert the digital transfer into cash. And most of them did, okay? So as a consequence, beneficiaries were 24% more likely to leave their home during the quarantine to collect their money and to convert the digital transfer into cash. And, you know, as a consequence of this, one intended goal of the government, which was to make many of these transfers, you know, electronically, to potentially mitigate having to make households leave their home and mitigate the spread of the virus. This, you know, was not very effective because in the end, you know, both beneficiaries that received their payments electronically or in hard cash had to leave their home to cash out their transfer. And as a result, they were more likely to leave their home relative to control households that didn't receive any transfer. And this clashes with the notion that digital payments, at least in the Colombian context, could offer an opportunity to distribute cash in a manner that was compliant with social distancing. In fact, a lot of the people reported beneficiaries in these earlier stages of the pandemic having to stay, you know, with very limited social distancing, waiting in line outside banks or inside ATMs or in cash offices, hoping to cash out their transfer. There were other interesting findings from the qualitative interviews. So kind of the problems in Colombia is that very few merchants accept digital payments, and mobile commerce in Colombia is still very much in its infancy. So the potential benefits of mobile money, at least in Colombia, are misunderstood. So hardly any beneficiary purchased any goods or services directly using the mobile app or the mobile money. So right now, the digital provider is considered just to be a means to an end, which ultimately is to get physical cash rather than a financial product that clients see themselves as adopting long-term. So people downloaded the app just so that they could receive the transfer, but not necessarily don't envision themselves using this digital, mobile money in the longer term. In rural areas, poor cell phone connectivity and obviously gaps in technological capacities for people to use smartphones negatively affected the use and the experience with this digital technology, and a lot of the costs had to, were borne by the clients, which were very poor households in a moment of like, a lot of like economic difficulties. And as I said, there was a burden of having to cash out the transfers in terms of time and travel costs. So to end, some of our policy implications were, well, just to recap, the cash had like the unconditional cash transfer had, positive, even if modest impacts on several outcomes. And, perhaps it's not surprising that the impact was relatively modest, given that the amount of the transfer was also very modest. But we should say that while introducing new payment technologies may facilitate the rapid disbursement of money, the underdevelopment of digital payments ecosystems, as in the Colombian context, may undermine some of its effectiveness. And here the experience of Colombia can contrast with the experience of a country like Kenya that has had a much more, developed digital payments ecosystem, and where beneficiaries have, been experiencing the use of mobile money for a longer period of time. So it seems really important to strengthen financial education and literacy to improve the effectiveness of some of these digital payments. It's also important to improve the infrastructure needed for mobile money to be effective, so improve cell phone connectivity in remote rural areas, encourage businesses to accept digital payments. And this just highlights the importance of developing digital payments ecosystems in developing countries to facilitate the deployment and efficacy of cash assistance during times of a crisis. I hope I didn't go over by much, but this is the end of
Thank you, Pablo. Thank you for your presentation. So now let's get started with a few questions for you. So I have a question here about the impact or that this emergency cash transfer had in the national budget of the Colombian government during this period.
So this is a good question. So, as I mentioned earlier, so let me go back to that in a minute, to the timeline. So I would say, the cost of this particular program was significant, but as I said, it was only one part of the broader response of the Colombian government to the COVID-19 pandemic, and it was not the most expensive. So perhaps, the most ambitious was this Ingreso Solidario program that, we did not evaluate, that try to target other Colombian households that were not beneficiaries of any social assistance programs. And the magnitude of that transfer was much higher than the unconditional cash transfer program that we evaluated. And similarly, the government also launched additional emergency transfers of the existing conditional cash transfer programs, and the program started targeting the youth and the program targeting senior citizens. And those emergency transfers were also larger in magnitude. So I would say, the combined response of the Colombian government was definitely, implied a substantial effort on behalf of the government in terms of the budget to respond to the household. But I should say one thing that we were interested in assessing is, like, since our unconditional transfer was very modest in value, as I said, only like 19 cents of a dollar per household, per adult per day, we thought it was particularly relevant because obviously for very poor countries, they may be limited in the extent to which they can respond to crises such as a pandemic. So, we thought that findings that such a modest transfer had nonetheless positive impacts on certain outcomes such as, financial health, or facilitating access to some poor households, access to internet to improve the education of the children, facilitating access to food was desirable, even if it was, very modest in magnitude.
Thank you, Pablo. So another question is, so this is like the short-term evaluation. So you mentioned this is looking at short-term outcomes of these unconditional cash transfer. So are there any other efforts to look into outcomes after this initial period?
Yes, so in fact, as I mentioned earlier, the government prior to the COVID-19 pandemic, had already planned to do a more standard, let's call it long or medium term evaluation of this program. And it was actually conducted by a different team. So I was not part of that evaluation. And, the findings are roughly similar to, the short of our short-term findings. But, in any case, I should add that longer-term evaluation also happened in the context of the COVID-19 pandemic. But once, many of the lockdowns or restrictions had disappeared. But the findings are roughly similar in terms of finding modest effects, which are consistent with the modest, amount of the transfer.
Thank you. So something that you touched at the end of your presentation, and it was one of the questions for Dan in the previous presentation, was about financial inclusion. So you touched a lot on what it meant for these beneficiaries to be receiving a cash transfers through a digital payment. So any follow-ups on this financial inclusion piece, or how can cash transfers be used to promote financial inclusion as in terms of policy?
Yeah, so that's a great question. So I think there's two elements to this. So there's one thing I didn't mention during my presentation, but is the following. Prior to the pandemic, again, and as part of its transparency, initiative, the Colombian government regularly has like public bidding in order to decide who are gonna be the contractors or the banks in charge of dispersing the different, transfers associated to the different transfers, to the different social programs. So prior to the pandemic, it had been agreed that starting in, I forget if February or March, a new bank was going to be in charge of dispersing the transfers of the conditional cash transfer and this new and conditional cash transfer. So this was rather unfortunate because in the middle of a major economic shock and in the middle of a pandemic, households had to get used to a completely new bank, but most importantly, a completely new technology to receive the transfers. So households were used to receiving the transfers in a bank account with the Banco Agrario, which is a very large bank in Colombia. But suddenly they were told that starting in March, they're going to have to work with a new bank that in addition was going to launch this digital wallet. Okay, so this poses an interesting question, which is there's a trade-off between, on the one hand, legitimate goal for transparency, which you want to regularly do like public bidding to see who's going to be the contractor in charge of dispersing these transfers. But this also generates challenges for poor households that may have to adapt to new payment technologies over time. And I've heard, in fact, that more recently, there has been a lot of like instability on behalf of the bank about which is going to be the technology that is going to be used for the transfers. So a lot of households, got tired with using this digital wallet and decided to revert to using, again, just standard hard cash transfers to cash agents in their municipality. But, it's really unfortunate if, poor households have to like constantly readapt to new contractors and new forms of disbursement. That's one element. But, in the end, I think given that, even poor households are now very familiar with using smartphones, I think the technological limitations can be resolved relatively quickly. I think the biggest limitation in Colombia right now is like there's not much you can do with the digital wallet in terms of actually buying things. So like, very few, shops or businesses actually allow you to pay basic consumption goods with a digital transfer to the shop owner. So this takes maybe a little bit of a longer time. How do you expand the digital payments ecosystem in a way that that improves the efficacy of some of these digital transfers? So I think that goes beyond financial inclusion. Most of these poor households now will have a bank account, and they may even have a digital wallet in their cell phone. But if other businesses don't start, receiving digital payments, they'll have to go through the process of having to go through a bank or a digital cash agent to convert the transfer in cash, in any case.
Thank you, Pablo, for elaborating on that. We have one last question for you related to the any related outcomes of the cash transfer with mental health outcomes, if you looked into any of that.
Yes, so great question. So we did collect several questions on mental health, and we actually did not find any detectable, statistically significant impact either on measures of physical health or or any physical or mental health. We also asked questions, for instance, about like, intimate partner violence, and didn't find any detectable impact on them either.
Thank you, Pablo. So just one last thing. So someone from the audience asked about the paper. So I sent the 2 links that I have, but if you can check if those are the right links, or you want to provide another one for people to see the working paper, please go ahead. It's on the Q&A function. And thank you, Pablo. So now we're going to give the floor to Naircio. So you can, Naircio, you can share your screen with your presentation. Welcome.
Hi, thank you. Thank you for the invitation to participate in this event. I think it's very important to discuss the effects of this unique episode in our generation. So I'm sharing my screen. I'll try to put it. Are you able to see it?
We can see it, but it's not on presenting mode.
No? Oh, because I have it on presenting mode.
Maybe you try it again. Maybe try again, see if that works.
No?
No, we don't see it on presenting mode.
Okay, can I go ahead with the slides? I think if I increase the size of the slide,
let's do that. Fine.
Yeah, thank you. Okay, so in this paper we look at the effects of huge emergency aid transfer that took place in Brazil soon after the pandemic, and the effects on poverty and inequality. And so this is more like an aggregate paper. We don't have randomizations, and we don't have treatment and control with, but as the cash transfer was so big and reached so many people, we look at the aggregate effects on poverty and inequality and think about implications for the future. So in terms of context, we know that lower and medium income countries were particularly affected by the pandemic. There was this fall in external demand because of problems with China and other developed countries. We had many non-pharmaceutical interventions spread around time, spread around municipalities. And so pre-existing challenges in our countries were enhanced by the pandemic. So we had an overcrowded health system, the poor living with restrictions on sanitation and space in their homes, prevalence of commodities, large informal sector, and especially in Brazil, GDP has not been growing a lot in recent decades. Okay, so these existing problems were aggravated by the pandemic. So the pandemic hit Brazil very hard in 2020, despite the fact that we have one of the largest public health systems in the world. So we have the SUS, Sistema Único de Saúde. It's free healthcare for everyone, basically, in the population. It's very well structured in terms of a primary care strategy. We have home visiting programs. But despite of that, maybe you all know that our President Bolsonaro was not very fond of vaccinations and non-pharmaceutical interventions. So because of these ideological problems, the pandemic hit Brazil very hard in terms of cases and deaths. So we had the third largest number of confirmed cases among all countries in the world by October 2020, inequality in the number of deaths by education and race. So the more vulnerable families were harder hit by the pandemic. So inequality increased a lot. Okay, so what we do in this paper is do a more graphical analysis using a nationally representative household level panel data. Okay, so we combined household surveys, the traditional household surveys we have in Brazil since 1970, with special surveys carried out during the COVID pandemic. Okay, so by using this household ID, we can follow the same household, around 100,000 households, before and after the pandemic. So we can compare their situation before and after the pandemic. Okay, so this is very important to understand the effects of the pandemic. Okay, so just for you to take a look how the inequality was increased during the COVID. Here I'm plotting the deaths, cumulative deaths in 2020 by race. So the orange line are the blacks and the blue line are the whites. And you see that since the start of the pandemic, the cumulative increase in number of deaths among the blacks was much higher than whites. Okay, and also if you look at internet access, studying, distance studying, all these were very unequal by race. So we're still waiting to see the final effects of the pandemic. In terms of the labor force participation, we had a big drop from here. We have the period before the pandemic, okay? 2018, first quarter, 2019, first quarter. So we follow the same households. And we see a small drop between 2018 and 19, and then a huge drop in 2020, of course, due to the pandemic, and then a gradual recovery throughout 2020, okay? But these shares are only returning back to the pre-pandemic shares now in 2022. So it took about 2 years to recover, okay? This is the working population. So it dropped from 56% to 49% and continued low. Unemployment rate declined because of the declining labor force participation, but then increased a lot over 2020s because people were getting back to looking for a job, but there were no jobs available. And lots of people worked from home. So the share working from home was 5%, then increased to 25%. And now it returned to basic pre-pandemic levels, okay? It's interesting to see again that the decline in labor force participation was much stronger for the blacks and then for the whites. And for women, for the less educated, the labor force participation was always much smaller than for the high educated. And also much higher for men than women, okay? But both were equally hit by the pandemic. So these are descriptive figures. And now let me talk about the emergency aid transfer. So it was implemented in April 2020 and was one of the largest federal cash transfer program in LA, in Latin America, or even in the world, because it's like 66 million beneficiaries. So these were cash transfers aimed at low-income informal workers and unemployed people. So it was originally designed to help people who lost their jobs because of the pandemic, okay? And didn't have any social protection like unemployment benefits or anything. So they were informal, they were working self-employed, and didn't have any, they were not in the traditional Bolsa Familia programs because they were not originally poor. They became poor because they became unemployed because of this demand shock, okay? So monthly transfers were $120, and you can have up to 2 transfers by family. So and single women receive double the value. So what I would like to emphasize is the value is huge. So a single woman heading a family would receive $240 per month. So this is like 1 minimum wage. So it's enough to live the family out of the poverty. So the scale of both the scale of the program and the value of the transfer is big. So it initiated in April, then it lasted until June, and then there was extension between July and August, and then a second extension between September and December. Okay. So we had some criteria. So people to receive the emergency aid transfer, they have to be older than 18. They could not have a formal job in the previous year, not receive any other federal income program apart from the Bolsa Familia. Their per capita family income had to be up to half a minimum wage, and annual taxable income below 28,000 reals, which is $5,700. Okay, so initially this program was targeted to the poor, as I told you, the ones that lost their jobs during the pandemic. But in the end, a lot of people received it because not many people have a monthly income higher than 3,000 reals, which is $600. Okay, so only 40 or 30% of the population have an income higher than $600 in Brazil. So the program was not very well targeted in terms of benefiting, especially the poor. That's why it was so huge in terms of the numbers. Okay. So one important thing is that all transfers were distributed using an app, and I think it's a very important lesson here. As opposed to the case of Colombia, there was not a digital wallet, but in order to be enrolled in a program, you should enroll through an app. You should download an app to the cell phone and enroll in the program. But the money would come like the Bolsa Familia money comes through the banks. So you just go to the ATM and withdraw the money, okay? But in order to enroll and to see if you are eligible to receive the transfer, everything is done through an app. So imagine like 60 million people accessing an app, putting all the data there, the age, the number of kids, the annual income, and formal sector status. And this data would go through the official database to be checked. So we have the highs that lots of people use, the administrative labor data, etc. And in the end, the government was able to enroll, like I said, more than 60 million people through the app. So this is very important and was very quick. So in April, so the pandemic really started in Brazil in March, and by April, the government already transferred $9 billion to 66 million beneficiaries. So this was very, very big. So the thing we would like to emphasize here is the scale and of the operation and the way it was done. So if it is possible to do that in Brazil, it's possible to do it anywhere and very quick. So by December, the government had transferred $55 billion to 68 million beneficiaries, okay? So now we're gonna use the household level panel data to look at the effects of this transfer. Is the biggest cash transfer program in the history of Brazil. So let's see what happened in terms of poverty and inequality, okay? So here I'm showing the poverty rates, comparing the levels of poverty before the pandemic. The blue line is the observed rates of poverty throughout 2020. And in the yellow line, we just did a simple counterfactual, just withdrew the money from the emergency aid transfer and computed poverty and inequality measures, assuming there was no behavioral changes, etc. So it's a very unlikely assumption, but just to have an idea of the sizes of the effects, okay? So before the pandemic, poverty rates in Brazil were around 12%, okay, 2018, 2019. After the pandemic, poverty rates declined to about 7% in August, okay? So we were hit by a huge shock, as everyone else was, but poverty declined, okay? And then after the benefit was cut by half and eventually ended, then poverty increased again. And if we just withdraw the money from the beneficiary, since we have household survey and income from all sources, it's very easy to do that. You just take out the benefit. Then poverty would have increased to 18%, okay, and remained as such throughout the pandemic, okay? So I'm not asking you to believe in this counterfactual because it assumes that there's no behavioral responses, but just, you know, doing this simple counterfactual, you can see the effects, what the effects might be of the cash transfer, okay? So here, the next one is extreme poverty. So people who have households that don't have money, enough money to buy food, to have the minimum calorie intake. So it was around 3.5%. So Brazil, just to say that Brazil has been very successful over the decades in reducing poverty and extreme poverty. In the 70s, this was like 20%, and now it's like 3% because of the Bolsa Família program. And then it declined to about 1%. So there was no like food insecurity in Brazil in the middle of the first wave of the pandemic, okay? If you take out the money from the transfer, you would be like 8 or 7%, okay? So it's as I said, I'm not estimating the impact of the transfer, but just to give you an idea of the magnitude of the transfer, you know, it's as it was so big and reached so many beneficiaries, it basically ended extreme poverty during the pandemic, okay? So here is the inequality. That's very interesting. Now, inequality, the Gini coefficient was 0.54 and remained around 0.54. So very little fluctuations between 2018 and 2019. And then after the emergency cash transfer, it dropped to 2.48 and reached the lower level of 0.47 in July and remained very low. So it was for the first time in Brazilian history that we have data for that inequality dropped below 0.5, the Gini coefficient. You know that Brazil is a very unequal country. And it was the first time that it dropped below 0.5, okay? And this says that if you take the money from the cash transfers from every household and recompute inequality, it would be more or less stable over time. Because the rich also lost a lot of money in Brazil during the pandemic, okay? They lost business and etc. And then there would be, as the transfer were reduced, there was a convergence in the values, okay? So it's also important to show that the minorities were much more benefited by the transfer than the more educated people, for example, and the whites. So here are the blacks, the blue lines are for the blacks. And you can see the difference in the lines is huge for the blacks, okay? So the reduction in poverty, of course, initially the blacks were much more poor than the whites. There were only 7% of the whites were in poverty as opposed to 17% of the blacks. But then poverty declined substantially for the blacks during the pandemic, okay? And for the whites, it declined less, as you would expect, because the blacks received much more the transfer than the whites, okay? And if you look by education, you can see the huge impact in the orange line is the behavior of poverty for the less educated, people less than high school. And you again see a huge drop as compared to what would have happened without behavioral responses if you withdraw the money from the cash transfer. And for the whites, there was a drop as well, but not significant. So there was no much effect for the whites. The effect was huge for the blacks. Okay. So those were the main findings I wanted to present. And I would like just to spend a little time on conclusions. So we have a country, Brazil, that's historically one of the most unequal countries in the world. Okay? We had slavery until the end of the 19th century. We have, it took a long time for us to invest in education for the masses. So only the elite received college education, for example, until the end of the 20th century. And then suddenly there is this pandemic, and Brazil in 1 month implements one of the largest federal cash transfers in the world, benefiting 66 million beneficiaries in a government that always complained about Bolsa Familia, criticized Bolsa Familia, said that Bolsa Familia was not a good program. It induced people to have more children, to leave work. And then suddenly there was this huge program. And poverty and inequality declined to historically low levels because of the sheer size and value of the transfer. Not only the number of people receiving it, but the value. If you were a single mother, for example, you would receive 1 minimum wage, which increased a lot in Brazil in the last 20 years, okay? So there was a drop in poverty and inequality. And also the use of the app allowed the government to be much faster and focused. It was not that, like targeting was not that good, but because too many people received it, more people than actually needed. But all the poor received it. So people were afraid that the poor would not be able to use the app or use the smartphone, but this didn't happen. They would get help from someone, from parents, from cousins, from neighbors. So even the very, very poor in rural areas were able to enroll in the program and receive the money. Okay. So I would like to end with a couple of questions. So it's possible to reduce poverty and inequality in Brazil. We've seen that in the middle of a pandemic that took thousands of lives. So why can't we do that in normal times? So what's the political economy things involved in being able to implement a country, a program in a government that's very right-wing, in a country that never actually reduced its inequality, and in a short period of time, what was required was a shock, a health shock, to change the political economy issues and implement this huge program. So this is the first question. So why can't we do that in normal times? And the second question is, can we use the app to improve targeting in normal times? So when the pandemic is over, we didn't have any new case in São Paulo this week. So when the pandemic is over, are we dropping the app and going back to the cadastro? Or can we use the app to target, to be able to respond quickly to changes in conditions of self-employed and implement a much more flexible program? Okay, so these were questions that I don't have the answers, but I would like to leave it for the thoughts, because Brazil is such a big country and has lots of influence and is going through difficult periods. So maybe we can use this experience to improve things ahead. Thanks very much.
Thank you, Narcy, for your presentation. and for the good questions to finish your talk. A few questions for you before we continue with the next presentation. So you mentioned this program was implemented between April and June 2020. Was there any extension of the program through other COVID variants or any other studies that have been carried out that you would want to mention or incorporate in this conversation?
Yeah, it was extended to the end of 2020, basically. And but then it's a good question, because even if the original program ended in 2020, we had the second wave in 2021. So a reduced version of the program continued in 2021. So unfortunately, we don't have the data, because this special household survey was carried out only in 2020. So we would like to see the effects on 2021, but we haven't got the data. But like the value was reduced by half, and there were further checks on the requirements to receive it, because Brazilian society had the impression that it was like too big and reaching even people that didn't need it. So there were small changes, but it continued until the end of 2021, a reduced version of it.
Okay, great. So one question is related to crime. Did you look at any correlation with crime outcomes in cities or any different parts of the country?
No, I haven't, because these household data do not have crime information, but other studies did using administrative data, and there was a fall in crime and in domestic violence over the period. But there is a question of notification, because people were not able to go to and report like violence and crime because of the lockdowns. So there was a question on whether the reports of violence and crime were the same that before the pandemic, but generally there was a fall in reported data in both violence and crime. And I think it would be nice once we have more data to look at these effects, because this was an amazing, a very different year with all this inequality reduction and poverty reduction. So once we have administrative data and covering this period, we can do much more in terms of research.
Yes, of course. Yeah, I was actually going to ask you about IPV and early pregnancies, but you touched on that as well already in your answer related to crime. So I don't know if you have anything to add related to that, or that
we looked at the administrative data in another paper on pregnancies, and what happened in Brazil was the number of conceptions declined during the pandemic, because people were scared of the pandemic and of the overcrowded health system. But there were no changes in early life indicators like weight or length or Apgar. And so we're doing some more sophisticated research to try to understand why this is the case. But the number of conceptions really declined, were the lowest for like 10, 20 years. So this changes a lot, because there will be some composition and selection issues, etc., that we are trying to address in new research.
Thank you, Narciso. Do you have any materials or links that you can share with the audience to access this work?
Yeah, sure. I have a policy paper that I can share with a more detailed analysis that I conducted here.
That is great. Thank you so much, Narissa,
Okay,
for
thanks very
your
much.
presentation. And now we have Kibram to close our great conversation today on the impacts of cash in the pandemic. So Kibram, if you can share your screen now with your presentation. We cannot hear you. You're muted.
Apologies. Okay.
No worries.
Now shared full screen. Let me turn to it. Okay. Can you see this?
Yes.
Can you hear me
Thanks.
clearly?
Yes. Correct.
Okay. Thanks everyone, and thank you for your invitation. So the paper I'm presenting today looks at the effects of the COVID-19 crisis on food security in Ethiopia, with a specific focus on the Ethiopia Social Protection Program. This is joint work with Kibrom Abba and Bush Perhana at IFPRI and John Hornott at Cornell University. So the motivation for this work is the unprecedented disruption the COVID-19 pandemic caused in global food, health, and social protection systems. And recent projections by the World Bank and World Food Program showed the magnitude of the problem. So a projection by the World Bank in 2020 shows that the pandemic is likely to push between 110 to 150 million people into extreme poverty. And a third of these are likely to be in Africa. It's also projected to double the number of people facing acute food insecurity. In terms of potential mechanisms through which the pandemic can affect food security, we can at least think of three channels. The first one, the direct channel, is due to kind of contraction of the virus and associated loss of earnings, because people who have contracted the virus are less likely to work. And second, even in the absence of directly contracting the virus, fear of contracting the virus, as well as associated government restrictions aimed at reducing the spread of the virus, are likely to reduce income-generating activities of households. And the third channel we can think of is disruptions related to market disruptions and disruptions to food value chains that make access to foods very difficult for a significant fraction of the population. Under these circumstances, social protection programs can play an important role. But as you all know, the social protection programs are really complex to design and they're expensive to implement. So developing countries who have limited resources to implement such social protection programs are likely to be hit badly compared to relatively developed countries. So I give you a slightly different number than the previous presenter. So Ugo Gentilini and others show that since the outbreak of the pandemic, there has been expansion of interest in social protection programs with more than 200 countries and territory sectors, including like small islands, etc., that have tried one or some form of social protection programs to kind of mitigate against the impacts of the pandemic. We are only now beginning to understand the impacts of these interventions. So in this paper, we asked two simple questions. One, what's the impact of COVID-19 on household food security? Two, are social protection programs effective in mitigating the adverse effects of the pandemic? For that, we focus on Ethiopia's flagship program called the Productive Safety Net Program, PSNP. I'll be referring to it as PSNP from now on. And we combine a pre-pandemic face-to-face survey with a post-pandemic phone survey on households, mothers, and children to answer the two key questions outlined here. To give you a bit of context, on the social protection program in Ethiopia. The PSNP is Ethiopia's flagship rural food security program. It benefits approximately 8 million people, and it is targeted geographically and at the household level. Geographically, it operates in districts that are historically, chronically food insecure. The determination of which districts are food insecure is done based off of historical food aid allocation, which is also used to determine the number of households within these waradas. Waradas are districts, it's a local name for districts. So the number of beneficiaries is also determined based off of historical disbursement of food aid to these districts. At the household level, targeting is primarily done using community-based targeting, and households are selected to participate in the program based off of their historical food insecurity status, their asset holdings, primarily land and oxen, and availability of other sources of income. The beneficiary list is updated annually as the circumstances of households change. So the beneficiaries are primarily employed in labor-intensive public works program that is approximately the case for 85% of the beneficiaries. There is small share of households beneficiaries that receive unconditional payments. So basically, the households who engage in public works are households with able-bodied labor, and households whose primary income earners are disabled or elderly are enrolled. They are given unconditional payments. Payments are primarily in terms of modality. Payments are primarily made in cash, but there is small in-kind transfers in areas that are less accessible to food markets. In 2018, additional activities that were aimed at making the PSNP program nutrition sensitive were introduced, and it is the waradas or district that implemented this additional layer of program that we study in this paper. So when the PSNP, so the COVID-19 hit, you would expect maybe the way PSNP operates may change in response to that, but in the Ethiopian context, that was not the case, except one change, which is kind of to reduce, because these payments are made monthly, to reduce the contact between beneficiaries and the people who run the program. So it was decided that they were going to be given just in one lump sum payment, but the implementation was not smooth. So actually, with lots of delays, leading to repeated interactions between beneficiaries and operators of the program. So to give a bit of context of COVID-19 in Ethiopia, so the first case was recorded on March 13th. And since a range of restrictions were put in place, including restrictions on public transportation, large gatherings, school closures, domestic travel, the mandatory quarantine of international travelers, and shelter in place, all of which took place in March at different points in March, between March 13 and March 24. This culminated into declaration of state of emergency on April 8, 2020. But these restrictions were gradually relaxed. So as of today, we have roughly 470,000 confirmed cases and a little over 7,500 days. So when it comes to our sample, almost all of the households in our sample had heard of COVID-19. I'll talk a bit more about the sample in a bit. About 70% report that they are extremely worried because of the coronavirus pandemic. So the data, going to data. So we have a baseline data. So what makes this work interesting is we have a pre-pandemic data, which was collected face-to-face in April 2019 in 88 districts where, as I mentioned earlier, the nutrition, where the nutrition sensitive PSNP was supposed to be operational. So in total, there are approximately about 400 districts that have implemented the PSNP program, but about 88 implemented the nutrition sensitive component. Our sample comes from these 88 districts. So our sample consists of households that have that had at baseline, that's August 2019, a child under 24 months old, and households ought to be PSNP beneficiaries. And if they are not beneficiaries, they have to be considered poor. I can discuss about the criteria later if necessary, but effectively we have PSNP beneficiaries and non-beneficiaries that look like in many observable characteristics. In June 2020, we conduct a follow-up survey of these households. So our baseline survey has 2,551 households. In the follow-up, we were only able to reach approximately 59% of the households. It is interesting. So the numbers seems to line up with the numbers shown by previous presenters in this webinar. So in the baseline, the August 20 baseline, respondents were asked to give their phone numbers and for their willingness to be contacted by phone if the need arises. And it is that information we use to reach back to them in the follow-up survey. So we have managed to reach 59% of our baseline households. So basically, to assess the impact of PSNP on a range of food security outcomes, we employ standard difference in difference strategy where we compare food security outcomes of PSNP beneficiaries and non-beneficiaries before and after COVID-19. However, as I shown in the previous slide, only 59% of the baseline respondents were reached in the follow-up survey. And in our sample, mobile phone is not a randomly distributed among sample households. It's an important measure of wealth in this survey. So there is a systemic non-response in our survey. So to deal with this potential systemic non-response, we use inverse probability weights. So at least based on observed characteristics, the follow-up sample looks similar to the baseline characteristics. So we can compare the mean outcomes of food security outcomes before and after for PSNP and PSNP beneficiaries. So mean tests, etc., are included in the paper. If anyone is interested in this, you can check it in the full paper. So let me give you a bit of descriptive results. So we asked our respondents which aspect of the COVID-19 crisis had the greatest impact in their lives. And by far, the two most important dimensions are market closures and being sick or fear of getting sick. These are the two most important ways in which COVID-19 affected people's livelihoods. And of course, food prices are and loss of income due to unemployment are another important concerns for households. So we have also asked households to report if their food security status has improved now compared to 3 months ago. As I mentioned, our survey was implemented in June. So the 3 months period covers the 3 months preceding the survey. So roughly 50% of our households report that their food security has worsened. So here food security is measured in terms of their ability to satisfy their food needs. Interestingly, there is significant variation in the rate at which food security worsened by COVID-19, incidence of COVID-19 by zones. So zones are the third administrative level in Ethiopia. So we divide zones based on the incidence of COVID-19, reported cases of COVID-19. So as you can see here, the number of households that report greater deterioration in their food security status is higher in areas with high COVID-19 cases compared to areas with low COVID-19 cases. So going to the food security measure, so we have two measures of food security. The first one is what is referred to as the food gap. It's a measure of the number of months in the 6 months preceding the survey during which households had difficulty to satisfy their food needs. And this ranged between 0 and 6. So 0 if they had no problems satisfying their food needs, 6 if they've had problems satisfying their food needs for all 6 months. So 2 means they had problems satisfying food needs for 2 months. And we create a dummy variable based off of this that takes value 1 if households report having difficulty satisfying their food needs, 0 otherwise. That is, if households report difficult satisfying food needs for at least 1 month, so the value of this variable would be 1, 0 otherwise. As you can see here, between 2019 and the 20 round, that's the pre-COVID and post-COVID rounds, incidence of food insecurity has gone up, the food insecurity rate. Roughly, it was 51% before COVID, and it's now approximately 59% after COVID. And interestingly, there is difference between PSNP and non-PSNP beneficiaries. As you would expect, pre-pandemic PSNP beneficiaries tend to be slightly poorer and less vulnerable to food insecurity, and it shows here. So incidence of food insecurity was 55% pre-COVID. For non-PSNP, it was 49%. It has, excuse me. So in the aftermath of the start of COVID-19 pandemic, this has gone up for both groups, but significantly higher for non-PSNP beneficiaries than PSNP beneficiaries. And this is consistent with what we see in panel B, where we plot the number of months households had difficulty satisfying their food needs. The pre-COVID average was 1.3 months, and it's gone up to 1.6 months. This is for the whole sample. When you divide the sample by PSNP beneficiary status, you see that clearly it has increased for both groups, but by significantly more for non-PSNP household members. Now going to regressions, I'll just show you what this means. So as I indicated earlier, I think I should go back to make this clear. This is our regression specification, and the coefficient beta naught here shows the deterioration in food security for everybody. And this is the marginal difference in the change in food security for PSNP beneficiaries. So the graph I will show you plots beta naught and beta 1. So going here, you see that in the post-COVID period or the COVID period, food insecurity increased by 12 percentage points for non-PSNP beneficiaries, but it is 9 percentage points less for PSNP beneficiaries. So the way to interpret this is, this coefficient here is a measure of the protective role of the productive safety net program, kind of compared to their non-PSNP peers. PSNP beneficiaries are 9.3 percentage points less likely to be food insecure. In terms of our raw measure of food gap, this translates to kind of a 0.34 months reduction in the number of months they would have food insecurity. That is, between the pre-COVID and post-COVID period, food gap increased by almost half a month for non-beneficiaries, but it is less by 0.34 months for PSNP beneficiaries. So this is again the protective role of PSNP. It reduces exposure to food insecurity by about 0.34 months. Next, we explore heterogeneity by poverty status of households and remoteness of the residents of households. Poverty, to look at the heterogeneity by poverty status, we split the sample into the top 40% and the bottom 60%. So the top 40% would be the non-poor, and the bottom 60% would be the poor households. As you can see here, the COVID-19 pandemic affected non-poors more because their incomes are higher, they are likely to lose their incomes than the poor who are already living in at the peripheries, at the age of kind of survival. But the effect of participation in the PSNP program is kind of, while the coefficients are comparable, as you see, the effect for the non-poor is statistically insignificant. And going to the remoteness measure, we find a consistent story. That is, it has greater impact in areas that are remote or less accessible, that have less, that are not accessible, that have poor access to food markets, for example. So the takeaway here is that there is heterogeneity by the characteristics of the household, that is poverty status and remoteness, and the protective role of PSNP is higher for the poor and households who live in remote areas. So the summary, to summarize, we find that food security deteriorated during the COVID pandemic. Market closures, price increases, and loss of income are important dimensions through which COVID-19 affected household food security. Ethiopia's productive safety net program played an important role in mitigating the impacts of the pandemic on food security. And the impact is higher for poorer and remote households. However, we find no impact on other dimensions of food security, and for example, diversity of diet of mothers and children. To be a bit more precise, there is an increase in consumption of fruits and vegetables, both for children and mothers, but consumption of animal products dropped dramatically. But the diversity of diet, measured in terms of the number of food groups children and mothers consume, we see no change. So our findings highlight the importance of having a well-functioning social protection programs in protecting against food insecurity in poor communities. Thank you.
Thank you so much, Kibram, for your presentation. So we have a couple of questions for you before we close up our webinar today. So shops being closed and markets not opened, it's curious, right? Shops being closed, the lowest, and markets not open, the highest. Were in shops in the market?
Say it again.
Sorry.
So I didn't hear you.
So the question here, it says shops being closed, right? In the lowest, and markets not open in the highest. Seems curious, right? We're in shops in the market, kind of like how to interpret these two opposite sides of this graph.
Yeah, so this is an interesting question. So our sample is rural sample, and usually we have rural market that open a few days a week. And because of government restrictions on gatherings, people were not allowed to go to markets where you have big gatherings. Shops mean like rural, like small kiosk shops in rural areas. This remained mostly open. and these were not a concern. But large food markets, which took place in rural areas like a few days a week, were closed for a few months, and that was a big concern. I hope I have answered your question.
Thank you. Yes. So one more for you. So can you expand a bit more about the matching of households? So I know Ethiopia has lots of highlands, so I expect considerable climate variation. How did researchers tease out matching households?
Yeah, so our study covers the 4 largest regions in the country, Amhara, Oromia, Tigray, and Southern region. That's the nutrition sensitive component was implemented first in these 4 regions. It has expanded since. So in terms of matching, that is PS, I assume you mean PSNP and non-PSNP beneficiaries. Is that okay? So as I mentioned earlier, the targeting of the PSNP beneficiaries was done at the Warada and the household level, at the district and the household level. So both PSNP and non-PSNP households were drawn, the sample of PSNP beneficiaries and beneficiaries was drawn from Waradas where PSNP is operational. So the Warada level targeting is not an issue. So the issue would be the community targeting. So the community targeting looks at household assets, importantly, number of oxen, land ownership, availability of other income sources, and historical food insecurity at the household level. People who did not make it through this criteria are excluded from the process. So in selecting the PSNP, the non-PSNP households, a subjective reporting of people's food insecurity status, kind of a Likert scale type ranking of food security on, I think, a scale of 9 ranks were conducted, and households who reported their status in the lowest 4 ranks were selected. And then their characteristics was matched against PSNP beneficiaries to establish that, at least based on observable, they are similar. So we show in the paper they're roughly similar, but slightly poorer because so slightly better off than PSNP beneficiaries. And it shows here. You see, like these are relatively well-to-do than non-PSNP. But in most other dimensions, they're similar in terms of education level, household size, etc.
Thank you, Gibram. We have another one here. Can you please expand more on how to interpret the results? What is the marginal effect on food insecurity and food gap?
Okay, let me take you there. So these are coefficients from difference in differences, identification strategy. So these would be the average effect for everybody in our sample, that is for PSNP beneficiaries and non-beneficiaries. The interpretation would be, because this is a dummy variable, the outcome, it takes value 1 if a household is food insecure and 0 otherwise. So what this means is, in the post-COVID period, the likelihood of being food insecure increased by 12 percentage points for everybody. Now, in addition to this average effect, PSNP beneficiaries see a negative 0.09 decrease in their food insecurity in the aftermath of the COVID pandemic. That means for beneficiaries PSNP, food insecurity increased, but it increased by the sum of these two, kind of is 0.12 plus 0.09, roughly for PSNP beneficiaries, their food insecurity increased by 3 percentage points. For non-beneficiaries, by 12 percentage points. The interpretation would be similar with food gap. This is the increase in the number of months of food insecurity for everybody. That will be roughly half a month. But for PSNP beneficiaries, it is less by 0.34 months. So the total impact on PSNP beneficiaries would be the sum of 0.47 and 0.34, which is for non-beneficiaries increased by half a month. For PSNP beneficiaries, it increased by roughly is it 0.9 months? No, 0.13 months. That's it. So it is just a fourth of the impact of this, almost. That's how I would interpret the questions.
Great, thank you. Thank you so much. We have one last question for you. Is PSNP still running? What about the transfers? Are any other survey rounds are being planned or in the works that you would want to highlight or mention here?
So we do not plan to run another round. We did run another round and we're preparing it. So that the second round was focused mostly on impacts on health services because of disruptions induced by COVID-19. There have been issues for households to reach their health service providers. So that focuses on that. But when it comes to food insecurity, we don't have anything planned on that. But the program, PSNP, is still going strong. Roughly between 7 million and 8 million households continue to benefit from it. Actually, it has, in the last year or so, expanded a bit. So as I mentioned earlier, this is originally designed to be a rural social protection program. An urban variant of it is now being tested in the capital. So there will be an urban version, hopefully, that will be operational at scale. For now, it's just, I think, still at the pilot stage.
Thank you so much, Kibrom. So I think that's all we had planned for today. That's a lot of great information and research to consider in this to understand this shock that we're still trying to get out of and in different contexts. So I wanted to thank, of course, all of the speakers, Kibrom, Naircio, Pablo, and Dan, for sharing your research, your thoughts. This all is being recorded, so it will be accessible on the IPA's website. And I also wanted to thank Kara Vu from the communications team at IPA and Gabriel Olila from the social protection team at IPA. So Gabriel, do you want to give a few words to everyone before we close?
I mean, just to reiterate your thanks, I don't take the availability of the panelists for granted, so I'm glad that you could be here. And neither do I take the availability of the attendees for granted. I've been watching the number and seeing it jump around in the middle and then slightly start, dropping till the end. So thank you so much for making the time. I will share a link to the Recover Hub in the chat, so you can all go on there and read some of the stuff that we are doing. Of course, a special thank you to the sponsor of the hub, Bill and Melinda Gates, and yeah, go on there. As long as you have access to the website, our contacts are all on there, at least mine, the IPA team, so you can reach out if you have anything that you think would be of interest to us or to the hub in general. Thank you so much.
Thank you, great, Gabriel. I think that's all we have for today. Thank you, everyone, again. And yeah, we have a great rest of your day.